and welcome to the ASPS International Residence Forum podcast. Today we are discussing cultural sensitivity and aesthetic practice, focusing on how cultural ideals, beauty and patient expectation in different regions influence aesthetic surgery. Understanding these differences is essential for plastic surgeons practicing in an increasingly global and multicultural environment. Hello everyone, I'm Dr. Aleksandar Jovanović, plastic surgery resident from Serbia. It's my great pleasure to introduce Professor Dr. Smilja Tudjarova Gjorgova, a highly respected leader in the field of plastic reconstructive surgery from North Macedonia. Professor Gjorgova serves as the head of the Department of Plastic Reconstructive and Aesthetic Surgery at Faculty of Medicine, University of Skopje, North Macedonia. She has also served as the director of the Clinic for Plastic and Reconstructive Surgery at the Clinical Center Medical Faculty in Skopje for over 11 years, reflecting her long-standing leadership and commitment to the field. In addition, she's also having her clinical and academic roles. She's the National Secretary for North Macedonia, actively contributing to the advancement of plastic surgery both regionally and internationally. She has completed her fellowships in Lucerne, Switzerland, also in Ghent, Belgium, for both breast reconstruction and periorbital surgery. She has been a member of many international societies as American Society of Plastic Surgeons, ISAPS, also other microsurgical societies, ICOPLAST, and many different. With extensive experience in reconstructive aesthetic surgery, Professor Gjorgova has dedicated her career to patient care, education, and the development of the next generation of surgeons. Her work reflects a strong commitment to surgical experience, excellence, collaborations, and continuous evaluation of our specialty. Professor Gjorgova, thank you for joining us today. It's truly a pleasure to have you with us today.
Thank you. Good afternoon to everybody. Nice to be part of this podcast today.
Thank you. We can start now. First of all, I would like to ask you about the region of North Macedonia and Balkan region. It has a unique blend of Eastern and Western influences. How would you describe the prevailing beauty ideals in our region, and how do they influence patient expectation, aesthetic, and reconstructive surgery as well?
At first, we can just speak about the national and culture approval of orthostatic procedure. All the patient men and women are very suspicious about aesthetic surgery, but I think the latest 20th and beginning of 21st century, we can just speak a little bit more about aesthetic surgery. Balkan region is very famous for the ladies with a huge breast. In that case, we can say that we have a lot of more reduction of the breast than implantation of silicone implants. Anyhow, here in this group are also the coming men who has also gynecomastia. And as everybody know, we done it both procedure, liposuction and surgical approach to remove the glandular tissue. Another thing is also interesting. The latest 7 or 10 years, we have also transgender surgery. It means women to become a man and also a man to become a woman. Anyhow, when we produce woman to become a man, we usually have two sides of operation. It means they didn't like to have a fish mouth surgery, to have a line on their breast. And in that case, we solve the problem when done a liposuction and surgical remove the gland. And second operation, only the liposuction of the rest adipose tissue. Anyhow, this is simple things. Another thing is also important owing to minimal invasive surgery. We can just speak about maybe using the lipofilling techniques to a contouring of the face. Balkan region is very famous with skeletonization of face, it means of the ages of 40 or beginning of 50, they have protrusion of cheekbones and also um, ptosis of the nose and the other things. Anyhow, we had just done a small surgery like lipofilling of the cheeks region, also suspension of or classical rhinoplasty, or working of the tip of the nose, and also we have a lot of periorbital surgery. What means that? That means brow lift surgery, direct brow lift, infrabrow lift. It means under the eyebrow where the incision, and also classical blepharoplasty with removing the fat pads. Philtrum surgery, what is that? It's very important now. We are just using one stitches and making a deep philtrum, what improve profile size of lips. And also we done a lot of surgery, haloplasty as we say, to have permanent result, not using the fillers. Botox is also a part of minimal invasive surgery, but personally, I didn't like it to use a Botox on the patient. Anyhow, ear surgery is also nice, and removing also and reconstructing, removing the skin, and also reconstructing the crural helices. And on the old ages, like the men of 60s, they like to have a smaller horizontal diameter of the earlobe, and we done a small reconstruction of the earlobe of ear surgery. Another thing is also nice. The ladies has to have. They like to have prominent mamilla of areola mamilla complex, and we also done a small surgery in a local anesthesia. Also, we done a lot of liposuction of belly part, as we say lipocontouring of the abdominal part, combined sometimes with abdominoplasty. Tight lifting is also very nice and elegant surgical procedure combined with liposuction. And also uh, we made T-shape of umbilical part when we done surgical abdominoplasty of umbilicus, and it's very nice and elegant in a bikini on a summertime. We have also a lot of men who like to have very strong shape of the angular of mandibular part. In that case, we making also lipofilling and made angle of mandibula. We also have a lot of liposuction of a belly of a man, making six plate, as we coming and say we like to have a six plates on our abdominal part. In all this, we also performed a lipofilling of a dorsal part of the hand, because the deep line and wrinkles are common in those ages. Another part is also the part of cubital part and olecranon part of back side of ladies. It has also a lot of wrinkles, and when they're in summer dresses, it's visible. In that case, we put also a lipo there. Sometimes we combine a lipo filling with a PRP when we using to correct the neck wrinkles. Another thing is also interesting, especially at the young ages. They like to have cherry lips, or they like to have Korean lips. What means that? That means a very strong V shape of the upper part of lips. This is possible also with hyaluronic and also with lipo, and especially is very easy to make with a surgical haloplasty. Another things, when we are coming in the lower part of body, it means region of a pubis. We done a lot of lipo there, and because in very fatty ladies or men, it's promination of a pubical part, and it's not nice looking. Also, we done a lot of haloplastic and correction of labia minora, because they prominent and it's not looking well in bikini. Another things, but it's not very rare, is using silicone implants on the calf, especially in ladies, and pectoral parts of silicone implants in a man. We can discussing that Balkan peoples, as I say, they're very, very restrictive. They looking a lot of plastic surgeon around, and they are coming with some pictures, and already they see everything on YouTube, and they say you can done this kind of procedure like this one here. We have really a long discussion. I think as anywhere in the world is, but after that they are well, and surgeons are very happy when they saw their happy face.
And can I ask you about like a consultation and so the whole preoperative process? During consultations, are there any typical ways that you see in patients in this region that they express their expectations? Some like communicating patterns, concerns, or even like misconceptions compared to patients from other regions? Would you specify something like particularly?
Yes, as you say, I have opportunity to in my during my time of career to see and to work little bit in Belgium and in Switzerland, and I see that their patients are a little bit more patient than in Balkan region because in Balkan region they are coming directly to your office and say, "Do this." This is not happen in the other country. They are a little bit more soft patients, and they really wait and at first listen to doctor what they say.
But here in Balkan, we can say like that they are like more impulsive and that
Yeah, maybe
they're
they're coming from the sun. We have a lot of months of with sun, and we are more aggressive, I can say. Yeah, and in that case, we need to be really very diplomatic, and the result is as are. Yeah, we have really after that a good results, as we
may
can
I
see
ask
in the meeting.
may I ask about the differences that like during your long career and like all things that you had opportunity and to see and like to visit all those countries around the world and working internationally. From your perspective, are there any difference between different countries in Europe? Not talking about only Balkan region and North Macedonia, Serbia as well in that part. What are like your views of differences in aesthetic expectation of aesthetic surgery in different regions in Europe?
Okay, I can say that I'm also American accredited surgery facility resources inspector, and I'm going and opened the small ambulatory surgery of plastic surgery, especially in several countries. I do it. I do it also in Belgrade, and I'm really happy that one of very nice clinic there is Medicinski System Belgrade, and also the other one, and Solish Clinic also, and the others. Anyhow, also in Knokke I do, and also I open give certificate to start it with the working of a clinic in Knokke, and that's a small clinic of Ivar Varheningen. He is also part of ISAPS, International Society of Aesthetic Plastic Surgeon. Anyhow, and I'm really happy to see how they're working, what's happened there, and what kind of facility they have, and what kind of patient they also have it there. It's a nice travel through the world and to accept and share the experience. I can also mention that international symposium and meetings are very important for every plastic surgeon, especially for youngest one. Webinars also. On webinars, you can have a lot of time to have a direct discussion face to face, but you have also nice opportunity to see the new trends and new techniques for any kind of procedure. But international or world congress, like it will be 2027 Ecoplus Congress in Berlin, or also in Cancun now. It will be in October. ISAPS, International Society of Aesthetic Plastic Surgeon. I suppose to meet the other professionals there and to see what kind of surgery they perform. Example, in the past decades, that was nice to have bipedicular flaps for complex areola nipple for reduction of the breast. But now is a more approach with superomedial and tripedicular side of approach for reduction of the breast. For rhinoplasty, before 20 years, that was closed rhinoplasty working. But now, more of plastic surgeons performed open rhinoplasty because it's more easier and you see all the structure in your hands.
Yes, those are really nice concerns, and I really agree with you about talking those international societies meetings and also webinars and all kind that we are happy to have in 21st century possibilities of networking and sharing our experiences. I would also like to say that in front of ASPS we are also hoping to see in Houston in October in American Society World Congress as well. And I would also like to ask you, as both a clinician and long-standing director of a major plastic surgery center in North Macedonia, can you share some case where cultural awareness significantly influenced your surgical planning or patient consultations that you wanted to do in some way, but there's some really strong cultural differences that made to choose something else?
Direct answer is about the transgender surgery. It's not very appreciable between the colleagues also. Some colleagues are suspicious about this kind of surgery. Another thing of my 36 years career is very interesting case of one small girl
Yes,
around
please tell us more.
9 years. She has neurofibromatosis corporis and very ugly face and also a lot of neurofibroma around the neck part and the breast and also dorsum and on the both hands and on the both also legs. And I was already more than 12 years each September working on her to improve approach. And at first I done a very nice face of her, and after that I allowed her removing the neurofibromas of the fingers. The ladies, the small girl, now it's becoming a small ladies, started with working on computer. This kind of improvement of the life to be part of the life of every child, it's very interesting, and I am also very happy. I also done a lot of aesthetic surgery, and now in those years I'm working at University Clinic and Medical Faculty Skopje, and also part time I'm working in Jean Mitrev Clinic. That's a very nice, very modern private clinic in Skopje. And we have a lot of patients, especially for aesthetic surgery of a facelift, max lift, and submental lipo, and also breast and abdominoplasty. And it's a nice to have so a lot of patient. And now in those ages I can choose what work to choose patient, and I can say yes, I can stop with this one patient. Yes, you can go in a states clinic to work somebody of youngest plastic surgeon. This is very easy, this is very simple techniques, you can go there, and little bit more specific case I can working.
Thank you so much for sharing that answer and that particular case. I would like to talk a little bit about the diversity of surgery, aesthetic surgery, global wise. The differences between, for example, Latin America, for sure North America as well, then Asia, like eastern part of Asia, the influences of Eastern looking patients. And also we can also mention about, let's say, Turkey, that is in our neighborhood, their way of view of aesthetic plastic surgery.
Okay, just at first started with our neighbors. Turkey Path and Turkey Hospital and Turkey Tourism, medical tourism, especially the last maybe 5 years, are growing very fast. All people are go there. I think also from each part of the world, because on an Istanbul airport, I met a lot of people with a head airport there. What is visible, the other things, yes, and it's not. Anyhow, after that, we can say that we have a lot of people who are going in Malaysia, Indonesia, because everybody knows that their procedure are very lower price than the other part of the world, and for 5 or 7 days they're coming back. Sometimes we can speak about the border health. What means that? We everybody in each part of the world, we need to be careful a little bit about those kind of procedure, because patient go somewhere, they have a surgery and they're coming in their own country, and all the complication need to be solved. Sometimes those complications are really easy to be solved, but sometimes it's really risky. Maybe some days, some parts as robotic surgery are coming and working from a very far away from one part to the other part of the world. It will be not a complication part of the patient. And also a telemedicine using is very important. Maybe in that case, we can solve immediately all the problems, and patient can be operated anywhere, and with those kind of facility of eye technology, we can have easiest way for everything, especially the doctors, except the engineer and the others.
And talking about the view of different procedures, for example, when I traveled to Brazil and to South America for doing my fellowships, we all, like in plastic surgery, know that South America is specifically really well developed for body culturing
Yeah.
and body surgery. But reflecting on the other part of the earth, Asia, Eastern Asia, they're really well treating face, and also their patients there, they request many, for example, periorbital surgery, also upper facelift surgeries, and those. I think it's really something that I noticed during my studies and studies right now as well, that all kind and different cultures and different places in the world, they have completely different perspective of aesthetics and also the procedures that patients are requiring.
Yes,
Do you
Alex.
agree with me?
Yes, I'm agree with you. Yes, in Brazil, and there are started BBL procedures, and after that, after very famous Kardashian part, in each part they are trying to then doing the liposuction and put the ribs, 6, 7 ribs out to have a little bit smaller waist, and to have a little bit big lower part of the body. And if we're touching the Asia and China and Japanese, they know what kind of periorbital surgery they done. It needed. They like to look a little bit more European, and there is procedure like butterfly technique to correct to have a correction of a medial canthus of orbital surgery. And also people who has a face like a moon, with an oval face, they like to have a little bit prominent zygomatic part, and it's possible to done with a SMAS procedure, or to put out the fat to the intraoral part out, and the young lady will have a small dimple on their both cheeks, and it's looking very healthy.
Thanks so much for sharing those ways and techniques that are used in different regions. Can you tell us about some during your academical career um, and also professional career. Um, were there some uh, some unique encounters that you had and some experiences while treating uh, diverse cultural backgrounds or different patients, and how you ensure the ethical and patient-centered care in those moments?
Okay, I can start it with Switzerland, with Lucerne. There is one lady what expressed me. She was 87 years old and she decided to remove a second finger of her foot. Why? Because she liked to wear a small shoe for one size. And that
Mhm.
was very impressed for me because, to put out completely the finger instead of five, she can include the forefinger on the foot. Is not nice, but anyhow, the orthopedic surgeon done it. Another things in Belgium, when I saw at first transgender surgery, that was a team of four plastic surgeons, four urologists, four gynecologists. All are coming in operating room. They are operated 8 hour, 9 hour, and the men are coming wife, and it's interesting. The nurses just made also nail polish, and she go out with the red nails. Anyhow, surgical part of those transformation impressed me a lot because they have two patients per week. It's a lot in that period. That was I'm speaking about 1987 when I do my specialization there. Another thing is also very nice in Graves disease and Bazatova, yeah, and they have exophthalmos, protrusion of eye from the orbita. They done a lateral and also a medial decompression. It means to put out a piece of bone of a cheek out and the orbital part to solve and to have a little bit more place, and the part of the eye is looking once again a normal, and those patients are very happy. Another thing is also a birth center unit at University of Ghent. There was a severe burns, more than 80%. They have a special unit there in that period, and later also renovated and with the six boxes there especially for the patient, and they stay there. They have a nurse part every 6 hours. They are changed the nurses there because it's really hard working, especially the surgery, excision, transplantation, reconstruction. Especially very hard was the reconstruction of the nose part, and this is a really interesting case. I really was lucky to be there and to learn a lot. And anyhow, my mother and father-in-law, they are living in Kuwait in that period around 10 years, and I have opportunity to work in uh, 1 month during the summertime in hospital, we don't see a hospital and the others. And there I saw a lot of Arabic people and what kind of procedure they like to have. They're very beautiful lady there, and they have a lot of blepharoplasty and rhinoplasty in that period.
Can I ask you a personal question, like regarding all your stays and visits and all those experiences that you have had in your life? Uh, what is like what is the most likely for you the culture that you have seen? Uh, what is the perfect way that you think that like suits you the most in all those experiences?
Oh, I can say also I have one. My daughter, she's living in United States in Atlanta now. She's more than 12 years there. She's a doctor also, and I have opportunity to spend month or month and a half each year there, and I am really surprised all new technologies in United States and opportunity the doctors have with work there, and they're very practical, I can say. They have really nice interesting tips and tricks too. We can use it everywhere in each part during our procedures, and they have a really a good food, I can say. Very nice and good food there. Also, I like food of Mediterranean part, and also Macedonian Serbia, I think, is also a part of that. I like our paprika, our tomatoes. They are huge, and they're very tasty and very nice smell they have there.
Yeah, I really agree with you. Both food and and all those places. Atlanta is really nice city, and it has amazing medical centers that are worldwide known, and techniques that are using they're all outstanding. During your academic career and leadership roles that you have in residency programs and also in plastic surgery department of the University Clinical Center of Skopje, what guidance would you offer to residents and young surgeons in developing cultural sensitivity in aesthetic surgery? I think that it's not well covered during our residency programs, and I think that our specialty is really sensitive and specific regarding cultural diversity.
I can say that in each part of the world, we needed to splitting training on two parts. The first part from first till third year, and then is the second part, third till sixth year. What means that? In the beginning part, it's more important to spend somewhere 2 months or 3 months, like a fellow. But when you are on the 6 years, it's enough 40 days, 6 weeks to spend to learn something because you know a little bit more of plastic surgery. But it's also important in each country is a different. As I know, in my country is direct. You can go on a plastic surgery residency program. It's 6 years, but in the others country, you needed to done 5 years general surgery and then another years 2, 3 plastic surgery. Um, because I'm also a chairman of a training committee of EcoPlus International Confederation of Plastic Surgery. We just speak about that. That is very important. All the plastic surgeons have opportunity to spend 7 days somewhere or to spend 2 weeks on their own budget, but they can be accepted out of some university clinics to see how it's working there, what was the way of doing the surgical procedure, just to touch the field that there is a really differences in each country. And I suppose some days we can do the same things. As you know, Aleksandar, we have a student training program every summer, June and July. It
Mhm.
will take around 10 days. They have opportunity, all the students from Balkans country to coming and to learn the surgical skills, suturing techniques, fillers and Botox. But this year also, I think, Aleksandar, you have opportunity to coming on the microsurgery course. It
Yeah,
will,
I will be there.
yeah, like you invited, and to spend, I think, 3 or 4 days. It will be nice from each part of the Balkans to meet at first the students and also the young trainees is nice, and they have opportunity to work also in a department of forensic medicine.
Yes, those experiences are really grateful. Even from my own experience, I can say that all those trainings and different possibilities to visit some centers worldwide in different cultures. First of all, it gives professional career benefits, but other than that, that I think that is also really valuable is that you get cultural things about way people live, what they like to do, what are they even hobbies and something like that. I think it's really meaningful in our careers as plastic surgeon because aesthetic surgery for sure. I think you agree with me. Uh, the the main aim of aesthetic surgery is psychological um, satisfaction of the patient. Do you agree with me?
Yeah. It's very important. Yeah, psychological part of every patient after the surgery, especially the men. They're a little bit more sensible than the women's, And this part is very important, how they can accept it, their new face and something like that. Really, Alec, I am happy to see you on some meetings, maybe in Cancun. I'm really happy because I have opportunity during my life to have my daughter in the United States in one part of the world. The other one, Gloria Gjorgova, is here. She's second in a training plastic surgery. And I'm supposed that I can left another plastic surgeon who will be well trained somewhere and to share the experience. And Alec, I think as your father is a plastic surgeon, I think you will have a little bit more opportunity to learn from the best.
Thank you so much for mentioning that. Yes, we had both, Gloria and I had the opportunity to be raised in those conditions that are a little bit, let's say, specific. I'm really glad to meet you in all those conferences worldwide. I invite you also to come to Houston in October for the meeting of ASPS World Meeting. And it was really nice, and it was my honor to talk with you today about cultural perspectives of aesthetic surgery. I want to sincerely thank you for sharing your perspectives in aesthetic practice and for highlighting how regional beauty deals in North Macedonia, Balkan region, also in Europe, and also touching international aspects of aesthetics. Your insights reinforce the importance of culture competition as a core skill for modern plastic surgeons. I would like to thank Professor Dr. Gjorgova and special thank to our listeners. As aesthetic surgery continues to globalize, cultural sensitivity will remain essential to ethical, patient-centered care. Understanding the regional perspectives, such as those in Balkan region, Europe, and worldwide, helps surgeons deliver outcomes that respect identity, diversity, and patient values. Thank you again for joining us on the International Residence Forum podcast. Be on the lookout for the next episode. If you're a resident or fellow in plastic surgery, we encourage you to join the ASPS International Residence Forum. It's a place where you can connect with peers across continents, access educational resources, and be part of a global community committed to professional growth. Thank you again for tuning into the ASPS International Residence Forum podcast. Be sure to catch our new episodes. See you then.
We hope you enjoyed this episode of the Enhance Your Practice podcast series brought to you by ASPS University. You can listen to our other episodes on any of the podcast platforms where they are currently available, or you can download recordings directly from ASPS EdNet. New seasons and episodes coming soon on practice management. Please contact ASPS Education with your feedback and suggestions for future podcast topics. Thank you for tuning in.